Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have evaporative causes. Evaporative causes of dry eye. So in the dry eye evaporative causes we have intrinsic type and extrinsic type. So intrinsic type of evaporative causes and extrinsic type of evaporative causes. In the intrinsic type of evaporative causes the problem is in the eye. So this includes number 1, it can be due to meibomian gland deficiency, which can be due to posterior blepharitis, or it can be due to rosacea. In posterior blepharitis or rosacea, there is no proper secretion of meibomian gland. Meibomian gland will produce actually the lipid layer. In the lipid layer is deficient, that means the aqueous layer or tear film which is there, this can easily get evaporated, resulting in dry eye. Or some disorders of closure of eyelid aperture. If the eyelid is not closed properly, then obviously there will be increased chances of evaporation. Then sometimes low blink rate. In some conditions like Parkinson's disease or prolonged computer use or prolonged reading or by watching television for prolonged state, in these conditions the patient will uh, blink very less. So this can also result in evaporative causes of dry eye. Then we have extrinsic causes of dry eye. Now extrinsic causes of dry eye mainly occurs due to vitamin A deficiency, contact lens wearers and allergic conjunctivitis. So these are the extrinsic causes of dry eye.
thank you and thank you for watching.